Hi, I'm Michael. I did a project on the bacterial presence on the cell phones of healthcare workers like physicians and nurses and different ways we could try and clean them. Basically in high school I started out thinking I really want to consider research, but I don't know if how I'm going to do it. So I started trying a bunch of different projects and they started to not work out. And then I was just talking to my mother one day and we were discussing one of the doctors I had shadowed a few years before. And his method of staying on track with each patient was to go into the room, set an alarm on his cell phone, and start talking with the patient. Well, he made sure to wash his hands before and after every patient, but he never cleaned the phone. So after a while I started thinking, well, if he's doing rounds in the hospital, there are certain bacteria going around in hospitals that cause problems. So the idea was I would take the cell phones, see if things were growing on them, and then I would also check to see which of 3 different cleaning methods might actually be the most useful. And what I found was that the most useful cleaner out of my study was the standard hospital cleaner that they use on everything except cell phones in the hospital. And I did find that almost every doctor or nurse or any person in that hospital used their phone at least once a day, but didn't clean it more than ever. Going back and into the project, what I actually did was I swabbed the phones, stored the tubes, and then plated them over the course of several months, starting off with a bunch of hospital data, then actually going to private practice clinics. And so one of the major hurdles with that was the fact that for the first month, for all the hospital data, I had a full lab I was able to work in. I was able to incubate all of my plates, I was able to make all of my slides. And then because I was a little more crunched for time for submissions to Gorgas, I ended up having to create my own sterile laboratory in my kitchen. So I swabbed everything down, cleaned it up, bleached everything, and built my own incubators. Now, a problem with building your own incubator is that you might not be able to account for everything if you haven't done it before, so I ended up actually melting some of the plates I was trying to grow bacteria on. It didn't affect my data that much, but it was still kind of something I was upset I didn't take into account beforehand. And so doing this project and submitting to Gorgas, I started to realize that probably the worst part about research is actually writing it up and doing all the paperwork to get it turned in. I still enjoyed the experience of it, but I wouldn't want to say it was my favorite part of the project. And so I submitted everything. I placed as a finalist in Gorgas in 2010, so I got to go and present my presentation, and it was actually really fun to get up in front of people who knew more about the topic than I did and try and explain to them that I actually understood what was going on. And so it's something that I would say to everyone else is that even if it's something you're not really interested in, I'm a chemist, but this is an epidemiology study, it's actually good experience to get. It shows you what you're interested in, or even if it's just something you know you'll never want to do again, it helps you learn that. Another thing is, don't be discouraged by a project not working. I tried to use stem cells to simulate a squid neuron. That's not going to work for a high school student. You just have to keep looking. Don't think that everything in science has suddenly been eaten up by all the college professors. You can find a way to actually get a project out of everything.